Hi, thanks so much for joining in. I'm Alex Matthew and this is Your Money Matters on NDTV Profit, because for us at NDTV Profit, your money matters. It's as simple as that. We discuss everything related to money, not just your investments, but also your expenses on things like travel, luxury, and even health. In fact, that last bit is what I want to focus on today, because health insurance is something we don't talk about enough. So let's start with that topic. Of course, a lot of you are covered by your corporate health insurance policies, and we've always talked about the importance to have your own cover and to ramp it up over the course of the years as you increase your income. And even before that, in certain cases, a lot of financial planners have stressed the importance of putting health insurance first before you do anything else. But today I want to talk about why claims get rejected by health insurance companies and what your approach should be if your claim has been rejected. Joining me, my first guest today, is Siddharth Singhal, who is the head of health insurance business at PolicyBazaar.com. Siddharth, thanks so much for taking the time and pleasure speaking with you. Let me start by asking, according to your data, what is the kind of situation or what are the numbers that relate to rejection of claims? How many claims get rejected on average?
Okay, so I think first of all, thank you, Alex, for having me on the show, and I think it's absolutely important to talk more about health insurance as such. See, I think largely what we've seen is, at least as per our data, 94 to 95% claims get approved. Obviously 5-6% claims do not get approved, and largely there are a couple of reasons, and this number may vary from an insurance company to insurance company. So I think that's our data. I would want to stress more about why do claims get rejected. So there are a couple of reasons for why claims can get rejected, and then what should a person do to ensure that the claim does not get rejected. So I think the first and the foremost reason, and this is a large reason enough, is when a claim is made during a waiting period is not as per the policy terms and conditions. So what I mean by that is, for example, my health insurance policy has a 3-year waiting period in that for a pre-existing disease. Example, I'm suffering from heart-related ailment. Now, within those 3 years, if I go and claim related to heart, then automatically, since it's a part of waiting period already, so that in that scenario, the claim can get rejected, and claim in fact will get rejected. But if you make that claim beyond after you have served the waiting period, then obviously the claim will get honored. So this is one of the largest reasons, I would say, why a claim gets rejected, in most of the health insurance policies. And it's actually very important when you're buying a health insurance policy to understand what are the waiting periods in a health insurance policy. Primarily, there are...
So that, do all health insurance policies have waiting periods, or is there a policy in which you can reduce the number of illnesses where you have a waiting period?
Sure. So I think that's a very important question, Alex. See, most of the health insurance, in fact, every insurance policy has a waiting period. Many offer the option of reducing the waiting period. So there are primarily 3 types of waiting period. The one is the initial waiting period of 30 days, which is there in every policy. Which means that except for accident, you can't claim in the first 30 days. So if you claim, then the claim is liable to be rejected. Then there's a second type of waiting period called as specific illness waiting period, or we call it as slow growing disease waiting period, which is majorly 2 years in almost across health insurance policy, which means that certain listed disease named illnesses like cataract, hernia, etc., which are slow growing in nature in the body, won't be covered till the first 2 years of the policy, beyond which they will be covered. And then the third is the pre-existing disease waiting period, which is now standardized since 1st of October across the products. It's 3 years now.
Okay.
So yeah, so you have the option of reducing those waiting periods, by opting for those covers. So that is there. So actually, that's a very important thing for any person to look at while purchasing a health insurance.
So when you do purchase this health insurance, this is something that you should speak to the insurer about. If you have, for example, if you have a family history of certain illnesses, perhaps you should look at those illnesses and, if possible, reduce the waiting period, particularly if you're in certain age groups, right?
Absolutely. So I think just one thing I want to highlight here, Many of the now health insurance plans offer the option of reducing your waiting period to date 31st for largely common illnesses like asthma, BP, cholesterol, diabetes, high, if somebody has a high BMI, or even heart related ailment. So from a 3 year, if you pay 15-20% extra premium, then you can bring down the waiting period from 3 years to day 31. In certain cases it can be day one also, from the next day. So it's a very useful feature for the consumers.
Okay, so you mentioned pre-existing conditions. What are the other reasons why a claim can get rejected?
So I think the second thing is, in certain cases, 2-3 other reasons which come in is in case of a non-disclosure. For example, if I am suffering from a certain illnesses, for example, I have a cancer, and I buy a health insurance policy and I don't declare it while filling out the proposal form, etc. And then I go and make a claim for cancer, wherein if there is an investigation and it's a non-disclosure, then in that scenario the insurance company can reject your claim. So I think it's very important, while you are filling out a purchasing a health insurance plan, that you disclose any current medical or lifestyle related habits, or any past medical history, so that when insurance company is evaluating the proposal, they have all the information available with you, obviously, which is known to you. In certain cases, if something is inside the body and you don't know about it, then obviously you can't mention it.
Okay, so that kind of answers the question that I had, which is, if you are unaware of a situation, and you mentioned cancer, which is now becoming more prevalent, unfortunately, but the onset is sometimes something that you don't anticipate, and sometimes it's something that is not picked up. So in the event that you don't know about it, it's never showed up in any test, you will still be covered, right?
Yeah, absolutely. You will be covered. I think insurance is basically a promise between the consumer and the insurance company, that, consumer declares everything what is known as per the consumer, and then insurance company covers for the, high, risk event. So I think that is what is very important.
In terms of lifestyle habits that people tend to not disclose, I've met a lot of people that consume alcohol, that have the habit of smoking, that say that a month before they do their test, or a month before they sign on with an insurer, they will not smoke. And they think that that allows them to say that they don't smoke in their disclosure. Is that something that is a red flag that can cause problems down the line?
Yeah, absolutely. See, this can cause a problem because, lifestyle-related habits like smoking, alcohol, or in certain cases, if somebody is taking anything, any other substance abuse as well, all those can lead to a healthy or a complicated health outcomes, which could obviously lead to a claim. And if it is obviously not disclosed in the right full manner, that can lead to a problem at the time of claim. Because see, at the first step itself, health insurance, or any insurance for that matter, relies on the fact that the disclosures have been made appropriately to the insurance company. And I think once you've made a disclosure, once the insurance company has taken into account those disclosures, then there is no reason that the claim can be rejected.
But Siddharth, the point that these people make is, how will the insurance company come to know if they are smoking 1 or 2 cigarettes a day after they have made that disclosure, when they've not smoked 1 month before? So it won't show up in the tests, even if the tests are done. That is the thinking that they have. Why is it that it gets caught? Is it to do with the doctors that do the tests that come up, the regular tests when you get admitted? In those events, when there is an emergency, they will say the likely cause of certain illness is because of consumption of these substances. Is that right?
Yeah, I think, Alex, you're spot on, because if somebody is used to certain lifestyle habits, and obviously they don't, for the short-term thinking or the short-term gain, don't disclose it right then and there itself. But at later point in time, if something comes up and when you go for a hospitalization, and if those are obviously related to the hospitalization cost, and show up in either the consultations or in the test reports, etc. If they show up, then insurance company can kind of reject the claim. So that is possible. So I think it's always advisable, and we advise all our customers to give the declarations upfront, no matter if if you smoke or if you consume alcohol. It's always better to declare it.
Okay. One last thing on this aspect is, if you have a situation where you have not disclosed it, it has come up in the tests, but the illness is not related to that, will your claim still be rejected because you lied in your disclosure?
So I think, see, if you've lied in your disclosure, this could be a scenario. Again, there's no, straightforward yes or no answer to this, because since it's a, multiple things which get connected with each other, that lifestyle habit may or may not have resulted into the cause of hospitalization. But I think the fundamental fact that if the person is not disclosed in the first place willingly, when I say willingly, I mean, I already know about it and I haven't disclosed it, there could be a scenario that the insurance company may reject the claim.
Just an aspect. Okay, so we've covered quite a bit of this. Let's talk about the other aspects, which is, what do you do in the event where you feel that your case or your claim has been rejected wrongfully? Is there recourse that you have?
Yes, absolutely. See, I think there are multiple recourse options which the regulator has established. I think the first and the foremost is to approach, your advisor or the distributor, or let's say in case of Policy Bazaar, what we have started is something called as Claim Samadhan Divas, wherein we, call in the customers who have the grievances versus and the, insurance company underwriters, where we, solve the problems at one go. So that is one. You can always approach your advisors or the, platform that you bought the policy from. The second is you can write to the insurance company, management, or the ombuds, the dedicated person at the insurance company. The third thing is, obviously, you can go to the ombudsman. You can file a complaint with the regulator also. And the fourth and the final would be obviously you can go to any court of law in India and you file for this thing for your complaint.
Siddharth, is there a difference in the number of cases that get rejected when it comes to a cashless settlement or a reimbursement? Because those are the two options available. A lot of people now go in for cashless. Is there a better chance of you having a settlement in that case?
So I think, see, largely, I won't say that, cashless or reimbursement would have much of a role to play in terms of the final claim adjudication, because, claim adjudication or the claim rejection largely would happen because of these 2-3 reasons which we spoke about. Obviously, it is better if you go to a cashless network because obviously you don't have to pay the money upfront from your own pocket. It's easier, and I think there's been a lot of initiative which has happened in the past 1 year about the cashless anywhere facility, wherein you can also request for a cashless hospitalization even if the hospital is not a part of your insurance company network. Obviously, in that scenario, both the hospital, first of all, has to agree, and the insurance company has to agree to give that benefit to the customer. But largely, it is advisable, and it is better if a person goes for a cashless hospitalization. But nevertheless, reimbursement is also an option, that in certain cases where the cashless is not possible, you can always go for a reimbursement option. So I don't think the two are connected, or the claim rejection would be connected to a cashless hospitalization or a reimbursement hospitalization.
I have heard, this is anecdotal evidence, Siddharth, which is why I was asking this, that it's always more cumbersome to have a reimbursement claim, because you have third parties that get involved. They tend to ask you questions that are not necessarily relevant to the subject. The line of questioning often becomes a little bit problematic. Actually, I've experienced this myself. So is that something that you need to warn people against?
Yeah, so see, I think, like I mentioned, reimbursement obviously is slightly a lengthier process compared to a cashless, because in cashless, you have to basically show up at the hospital, or if it's a planned hospitalization, you have to intimate the, your insurance company maybe 24 hours in advance, and the insurance company gives the, cashless approval. So in that scenario, you basically don't have to pay anything. You have to just go show up at the hospital, get the treatment done, and then at the time of discharge, you get a cashless approval. Vis-a-vis in the case of reimbursement, obviously, you have to submit the documents, you have to submit the claim form, and there could be multiple documents that are sought after by either the TPA or the insurance company. So I would say that, like I mentioned, it's better, and one thing actually you can do is, at the time of buying a policy, look at the hospital which are a part of the cashless network of the insurance company. I mean, if I'm, let's say, living in certain part of Delhi, then the most nearby hospital that I'm likely to go should be a part of the network that I'm planning to purchase. I think it's advisable that way. But what I want to come to the point is that reimbursement may be a slightly lengthy process, maybe 6, 7 days, 10 days process. But that does not mean that the claim will get rejected, or
Yeah.
the amount that will be paid will be any different from that. Only the process is not the final judgment.
Absolutely. Okay, so point taken. Last point, how much time should somebody be willing to take to get a resolution in a situation where they've had to, for example, go to the ombudsman? Can it take a long time for claims to be settled?
No, so I think that again depends from a case to case basis. See, but I think there are multiple recourses which are available before you have to go to the ombudsman. Like I mentioned, one of the initiatives that we have taken as Policy Bazaar is to help the customers with the claims in a way of claim samadhan divas. Similarly, again, certain cases where we can present the case to the insurance company. So again, from an insurance company to company and from an advisor or the platform that you're purchasing from, that depends. And I think most of those cases get resolved at that point in time. One more thing, which many a times, claims get stuck either at the reimbursement level or any other level, is the need for documents. So sometimes a document is required to process the claim. In many cases, hospital has either not provided it, or maybe it got lost in transit, or something has happened. In those scenarios, those are small reasons because of which the claim gets sometimes stuck.
Yeah.
But largely, once that is done, it doesn't have a reason to get stuck anywhere. So I think from an ombudsman perspective, it does not take a very long time for the claim to get settled. But yes, can vary from a case to case basis.
Okay. Siddharth, thanks so much for joining in, for giving us that perspective. Certainly been an insightful conversation, hopefully a useful one for our viewers. All right, so we've spoken about how you can avoid getting your health insurance claim rejected, but there's something that is often said in medical science: prevention is better than cure. And to that end, I think it's important to talk about how you can avoid getting into an illness in the first place. I'd like to talk to you about the importance of periodic medical examinations, which can help stave off major lifestyle issues down the line. We've got Dr. Pratit Samdhani joining in right now. He's internal physician and intensivist. Thank you so much, Doctor, for taking the time. And I'm glad that you're speaking to us today. Would you say that a large number of diseases, particularly lifestyle diseases, can be headed off by doing these regular tests?
So Alex, absolutely. I'm completely for doing regular health checkups or medical examinations. Lifestyle diseases can certainly be mitigated, but as the word says, lifestyle diseases needs a change in lifestyle. This requires a change in lifestyle along with medications. And medications can only be prescribed not by looking at the person or the patient, but also going extensive tests. So health test includes not only blood examination, but includes a physical examination, including anthropometric medications, bone mineral density, your BMI, screening for diseases, common diseases like diabetes. In 2030, India will be the capital of diabetes. That's pretty shameful. Looking at your immunization schedule to prevent diseases, looking at cancer screening, cardiac screening, causes of sudden cardiac death, and of course, giving a collaborative prescription to the patient. So I think health screening is, I would say it's mandatory.
Doctor, a lot of people think for many years that they're too young to have this as a requirement. In your opinion, when do you start? And I know people who are 35, 37, 40 who say, hey, you know what, I'm too young to have a requirement to do this. And equally, I've heard doctors like yourself saying that that isn't the case. So in your opinion, when should you get your first periodic medical examination, and how often should you get it?
So that's a great question, and this answer truly is individualized. So if you have a strong family history, for example, of malignancy, of a premature coronary artery disease, I would start screening as early as the age of 30 and 35 and not wait for a 50 or a 70-year-old to get screened. But if you're healthy, you have no family history, your lifestyle is good, I would say at least start screening at the age of 30 for common diseases like diabetes and thyroid, and more extensive screening from 40 years of age. There are certain diseases, for example, malignancies that are highest or can be screened correctly. For example, breast screening for women should ideally start at 50 years of age, provided you have no family history, and should be done at least once in 2-3 years, depending on the report. Colon screening, colorectal malignancy is very, very common. A simple stool test, if it reveals blood or occult blood, you should think of a colonoscopy. It's mandatory in the West that when you cross 60 and above, you actually undergo a colonoscopy as a screening tool. Cervical malignancy is common in women, and it should be screened 3 to 5 yearly, and should start as early at the age of 25. There's often a disease called an abdominal aortic aneurysm, which patients don't complain of anything, or they may complain just a vague abdominal pain, can be easily screened by an ultrasonography. Typically happens in men, more common than women, above the age of 65. You have prostate malignancies, which one should start screening at the age of 50 and above. So it's individual, but if you have a family history of a strong disease, it's better to screen earlier. I often, Alex, say this: you don't wait for a woman to be 9 months pregnant and then after delivery realize that she was pregnant for 9 months.
Yeah.
So catch them young, catch them fast, treat them quickly.
I think what you described is not possible in any case, but I get the point that you've described. When it comes to women's health as well, I ask this because I've had conversations about this in the family as well, which is when it comes to the menstrual cycle and when it comes to the health of that menstrual cycle, there are complications that are often ignored because the person is just not comfortable going to the doctor. Can a periodic medical examination where you have the requirement of a swab solve certain issues that could come up?
Exactly, Alex. You're talking about cervical malignancy,
yes.
And that's a test called a pap smear. And I would say you must begin at the age of 25 and probably do it every 3 to 5 years, because the incidence of cervical malignancy is pretty high. So you should visit your gynecologist. It's a very, very simple spot-on test, which requires no invasive method to screen. You should do that. A sonography will also pick up anything in what we call the ovaries and the uterus, something as simple as a fibroid to something more complex like an ovarian mass. So you must start screening early.
Okay. The other aspect is the cost. And by my understanding, we're talking about a cost of anywhere between 6 and 10,000 rupees for a periodic medical examination. Doctor, correct me if I'm wrong. And in your experience, things like, for example, your blood pressure medicine or certain other diabetes drugs, insulin, what is the trade-off? If you head something off, you're talking about 6 to 7,000, 10,000 rupees per year, as opposed to what per year?
The cost of medical treatment and its complications is unsurmountable. I mean, it's infinite. If you catch someone who's younger at getting diagnosed with diabetes, you are probably saving 10 years of his life, decreases the risk of blindness, heart attack, stroke, kidney involvement. You're not only saving direct costs, but indirect costs and emotional costs, which is just huge. There are families where there's only one bread earner. And if you find someone who's got a diabetic complication 5 and 10 years down the line of him getting diabetes, losing a limb, losing his eyesight, just imagine if you're the bread earner of the family and if you're one of the patients. So I would say there's no comparison of, say, about a 6 or 10,000 simple health checkup vis-a-vis getting a disease or a complication and then coming to a doctor with a complication of a disease which easily could have been screened, diagnosed, treated, and probably prevented much, much earlier. Alex, I would also like to say, patients often come with health checkup reports and say, I've spent, for example, X amount and nothing has come. What a waste of money. You know what my answer to that is? You don't buy a life insurance policy to die.
Yeah.
You don't buy a car policy to create accidents. You don't buy a Mediclaim to get sick.
Yeah.
You buy it for the need of the hour if there's one.
Absolutely, it's preventive. The last question that I have is, there are quite a few tests that you said are covered in periodic medical examinations, and it's pretty comprehensive, but there are a few things that are not. And one of them, of course, is your allergen test, which sometimes people say you should get done, but it is pretty costly. Are there any tests that, in your opinion, should be conducted ever so often, not necessarily every year, but people should know about these things, and what would those tests be?
Good question. I'll directly head on to your allergic test. I think allergic tests should be done for patients who have allergic symptoms. I find no basis of doing an allergic test, especially food allergy, dust allergy, if you don't have respiratory problems or you don't have GI problems or gastrointestinal problems. So I think that's not mandatory. But mandatory is something like a DEXA scan, an osteoporosis scan, which is often not done. You come back with broken legs and limbs and spines. Mandatory should also be screening for malignancy. And I would say mandatory should be a simple calcium scoring test for the heart. It's a coronary calcium scoring test, which requires no contrast or no injection to be given. It takes 20 seconds literally. It calculates your calcium score and indirectly may tell you that you are at a risk of coronary artery disease. A simple cholesterol test is a part of the health checkup. Diabetes is a part of a regular health checkup. So there are some tests that are often not done, should be conducted.
That last bit especially, doctor, because we're talking at a time when young people, 40, 44, 45, are having heart problems, heart attacks. Thanks so much for joining in, for having this very important conversation with us.
Pleasure. Thank you, Alex.
That brings us to the end of this edition of Your Money Matters. Thanks so much for joining in. Do stay tuned. Lots more coming up on NDTV Profit.